Why is it important to screen for tobacco smoke use and tobacco smoke exposure, as I often do as a pediatrician? We all know how bad tobacco use is for one's health and for the health of those around us. And if we don't ask, then we don't offer the help that we need to offer to people who smoke, to our patients, and in my case, often to their families as well. As a pediatrician, one of the things that concerns me significantly is the health of my patients. We know that secondhand smoke exposure and third-hand smoke exposure are both very dangerous to children. They have very specific and broad effects on the child's health. And so it really is important that we minimize or remove those to those children. The other thing that's important to remember is that 90% of people who start smoking start so before they're 18, which means that our patients are the ones who are going to become the smokers. And children who grow up with parents or relatives who smoke are more likely to become smokers. So for so many reasons, we have to have these conversations. And we have to have these conversations regularly. It's not just once in a while or even with just a well check. I think it's important because we recognize that tobacco smoking is an addiction. And we really, if we think of this as a chronic disease, it's something that we need to help people with on an ongoing basis. With my patients, their families may not be ready to quit smoking, but I'm not going to stop trying to engage them and trying to help them. And so it is an ongoing process that should really be part of everything we do. It's so bad for kids to be around tobacco smoke. It has very specific and direct effects on certain of the disease processes that we treat commonly in children. So for example, bronchiolitis, asthma, pneumonia. So many of my patients who are hospitalized with these conditions have smoke exposure. That's a known risk factor for actually being hospitalized. And so it really is very much a part of the disease that I'm treating, and then tying that into the preventive care for the children, advocating for them to try to help their environment, help them, be in a safer, healthier environment. So the first thing is to invite them to talk about it. 70% of smokers actually want to quit, and they expect us as healthcare providers to discuss this with them, but nobody wants to be yelled at. And so I think it's really important to start the conversation with an invitation to hear the smoker's perspective. So often I'll say something like, I understand that you smoke. Is it okay if we talk about this? I've honestly never had somebody say, no, I won't talk to you about it. They may be a little begrudging. They're not quite sure what I'm going to say, but I try to understand where they're at. Most people, thankfully, smoke outside of the home because they know it's so bad. So they're motivated to do something for the health of their children. But it's really understanding where they are and what their motivation is that's going to help them quit. I can't quit for someone. I can help them define that motivation. So we really want to understand where somebody's coming from, where they're at in terms of setting a quit date. And then I offer the resources I know we have, for example, the Quit Line, which is wonderful, nicotine replacement therapy, close follow-up, some of the text messaging services, some of the coaching that's online by text, by the Quit Line. These are, I think in general, people need more than one way to do it. People may think they can do it cold turkey, and some people can, but most people really need support because it is so addictive. So offering that support and then supporting where they are in terms of making their quit attempt. Sometimes it will just be sort of a contract, a promise to not smoke in the car anymore. And that's a win for me as a pediatrician, because now that patient is not having third-hand smoke exposure, at least in the car. And the next time, then we take it from there. And it's an ongoing process, as I said before. If somebody is, I meet somebody for the second time who has quit, I still talk about it because I want to make sure they're going to stay quit, because we know that smokers also relapse. And so we share that journey with them, so to speak, to really be supportive and to make sure that the message is still there and the support is still there.